Hello, everyone. Welcome, welcome. Thank you so much for joining us today for this ADI Rehabinar, a webinar presentation about tech pain. My name is Brittany Butler, and I am a board-certified physical therapist here at ADI Rehab Incorporated. Today, I am going to be presenting on tech pain and the repercussions that poor posture can have on the body while working from home. I hope with this presentation that you will be able to learn something new about what is going on in the body as we slip into different postures while working from uncommon spaces around the home. Again, I just want to thank you so much for taking time out of your day to join us and to learn more about tech pain. So our objectives for the day are to define tech pain, identify the causes of tech pain, highlight the types of impairments brought on by poor posture, and understand what's happening internally by evaluating the structures that are being impacted by poor posture. At the end, we are going to go through the ways in which you can set up a healthy workspace using calming spaces in the home, and cover some of the steps you can take to minimize the onset of tech pain as you continue to work from home during this pandemic. So why is this topic important? The short answer is we are navigating the world virtually, and that means much more time is being spent in front of laptops and desktops. Unfortunately, if these devices are not properly positioned, the aggregate time spent in front of them can potentially cause adverse physical conditions such as musculoskeletal pain and headaches. So interestingly enough, back pain is the single leading cause of disability, preventing many people from engaging in work as well as everyday activities. It is the second most common reason reported for missing work and the fifth most common reason for all healthcare visits, behind skin conditions and osteoarthritis or joint disorders. Experts estimate that up to 80% of the US population will experience back pain at some time in their lives, and note that back pain can affect people of all ages, from adolescents to the elderly. Research shows that back pain costs Americans at least $50 billion in healthcare costs per year. And if lost wages and decreased productivity from workdays missed or factored in, that figure rises to more than $100 billion. So talking about the ways in which we can protect our neck and our back at home is really important so that people can minimize their chances of getting stuck in a state of disability, which can ultimately affect one's overall quality of life. So before we get started, I just wanted to test your prior knowledge of posture-related conditions and give you some questions to think about that we will answer throughout the course of the presentation. The first question is, which anatomical feature has the greatest influence of the development of a forward head, rounded shoulders posture? Is it the eyes, muscles, ligaments, or vertebrae? Second, which position do you think puts the most pressure on the discs of the lumbar spine? Lying down flat on your back, standing up straight, sitting slightly forward in a chair, or performing a weighted deadlift exercise? And lastly, how much weight do you think goes through the cervical intervertebral disc when looking down at a 30-degree angle at a cell phone? So I want you to go ahead and think about the answers to these three questions. Lock them away in your mind, and we will see later on if you are thinking along the right lines of what's going on in the body when it is put into poor postures. Okay, so let's talk about tech pain. What exactly is tech pain? Tech pain is a term we use to describe pain that can develop as a result of poor posture with prolonged use of technological devices. It presents in various ways in the body and can potentially have many negative impacts on one's overall health. While tech pain can present in many different ways, there are three main categories of tech pain that are pertinent to the types of pain we treat in physical therapy. Today, we will focus on headaches, musculoskeletal pain, more specifically joint and muscle pain, and then we will also cover nerve pain as well. I think it's really important to highlight here that these types of pain that one can experience from working in poorly postured positions for too long are not usually mutually exclusive and can often occur simultaneously. So we're going to start with understanding the types of headaches that can develop as a result of tech pain. The first type of headache we are going to cover is tension type headaches. Tension headaches are bilateral in nature, meaning that you will feel them on both sides of the head, and are typically triggered by increased muscle tension and sustained postures. Aside from the headache pain along the frontal and orbital bones that you can see highlighted in red, some of the common symptoms include neck stiffness or pain that is usually accompanied with a loss in cervical range of motion. Another type of headache that can result from prolonged poor posturing is cervicogenic headaches. Cervicogenic headaches are typically unilateral in nature, with the symptoms occurring on only one side of the head, in this case along the temporal bone, which you can also see in red. Cervicogenic headaches are also associated with cervical joint dysfunction, and one of the most common symptoms is pain with cervical range of motion. So any movements at the neck are not going to feel really great with this type of headache. Research shows us that increased cervical muscle tension can also be present in people who have been diagnosed with cervicogenic headaches as well. So now we are going to talk about some general muscular and skeletal impairments that can result from poor posture, because tech pain most commonly presents in the form of joint and muscle pain. One of the impairments that we commonly see with poor posturing is altered muscle tone. It is important to note that muscle tone is not the same as muscle strength. Muscle tone is the tension across a muscle at rest. Tone is what allows us to stay upright, maintain good posture, and be ready for action when movement is needed. Typically, muscles that are adjusting to spending prolonged time in poor postures will experience an increase in resting muscle tone, which I will explain in more detail when we look at why muscle weakness results in tech pain later on in the presentation. So joint dysfunction, or as we refer to it in clinic, mechanical dysfunction, is another common musculoskeletal presentation of tech pain. If joints are being held in sustained positions or are being put into positions that add further strain to them, it can alter the biomechanics of movement at that axis. This can result in pain with certain movements or an uncomfortable feeling of stiffness while attempting to move through a certain range at the joint level. So the last type of pain I want to touch on is a type of nerve pain that can result from poor positioning, which is called radiculopathy. So essentially, radiculopathy is just a fancy word for a pinched nerve. And this occurs when spinal joints do not move well, causing compression of the peripheral nerves as they leave the spine through a small hole to innervate the body. The most common symptom of radiculopathy is numbness or tingling that shoots down the arm or leg, but it can also lead to muscle weakness, decreased spinal reflexes, and a loss of balance over time. So why is all of this happening? Why are you developing sore muscles, joint stiffness, or tingling in the legs? The reason you are developing tech pain is because your body is being negatively affected by one or more of these four main factors. Whether it's poor posture, muscle weakness, overstretching, or an unhealthy workspace, tech pain has its genesis in the interaction of these four elements. So the first element we are going to dive into is poor posture. Because as we can see from this diagram, poor posture can have a myriad of effects on all of the body's structures and organs. The posture theory, which was created by Max Banfield after he spent 35 years researching the causes and repercussions of poor posture, revealed that poor posture puts added strain on the spinal joints and muscles, like we've talked about previously, that it puts increased pressure on intrathoracic structures like the diaphragm and the lungs, which can result in labored breathing, and that it also puts increased pressure on abdominal organs, which may impair digestion. Banfield also reported that poor posture can impair the flow of blood from the feet to the brain, which in turn can lead to acute tiredness and poor concentration. In the longer term, he found that poor posture results in inefficient circulation, leading to reduced energy levels and lower capacity for exertion. So while we are focusing this presentation more on the mechanical pain that can be treated in physical therapy, the posture theory reminds us that the repercussions of poor posturing goes far beyond just headaches, musculoskeletal, and nerve pain. I just really wanted to highlight that here to emphasize just how important maintaining a good posture is for one's overall health. So we already know that prolonged positioning and bad postures can alter the mechanics of a joint on a skeletal, muscular, and nervous level, which can lead to the development of spinal pain and headaches. But what structure is responsible for putting us into those positions in the first place? Remember our first trivia question? Well, the answer is the eyes. A little surprising here. So let's take a closer look and see exactly why this is. The anatomy of our eyes has a big impact on postural positioning, especially at the neck. Our visual field and the way in which our eyes are set into the skull play a large role in how we adjust our body to compensate for poor posturing. For example, I want you to hunch into your worst posture so that you were looking down at the bottom of your screen towards the keyboard. Without moving your head, I want you to try to look up towards the top of the screen. While you can initially hold this position, the eyes are going to tire out quickly because it is more uncomfortable to look up for long periods of time than it is to span downward. Let's look deeper into why this is the case and what effect this has on our posture. So here we have this lovely model who is demonstrating excellent posture. Now let's say that this model is working on a computer. Visual research shows that our eyes function maximally, looking straight out and spanning down at about a 30-degree angle, as this visual field allows the eyes to take in the maximum amount of visual data. But if our model rounds its shoulders and maintains the neck in proper alignment, you can see the optimal visual field will now span the lower half of the screen. Anatomically, the way the eyes are set in the skull, if you look up without tilting your head upwards, your orbital bone or your brow bone will actually limit your visual field. So as an involuntary compensation, you will actually raise your head up until your eyes are nearly reaching the top of the screen. But as you can see, the result of this involuntary compensation of tilting the head upwards, just to accommodate the need of the eyes to be in a position where they are optimally taking in visual data, puts the neck into a position of great compression that can ultimately cause pain. So when we take a closer look at what's happening on a joint level, we can see just how compressed the cervical segments are becoming as our head positioning adjusts. This positioning can lead to joint dysfunction, radiculopathy, and can even trigger headaches from the increased tension that will now be on both the spine, its intervertebral discs, and the surrounding ligamentous and muscular structures. So that brings us to our second trivia question. How much weight goes through the cervical intervertebral disc when looking down at a cell phone? The correct answer here is 40 pounds. 40 pounds of weight going through the disc in your neck just from looking down at your phone. That's a lot of weight going through the neck. And in the age of technology, that is even more scary because we are spending so much time in positions like this. Having such an amount of weight going through the neck acutely and over time can be extremely damaging to the health of the intervertebral disc and can even lead to the development of a herniated disc, a radiculopathy, or even result in an earlier onset of spinal arthritis. Now, what about the lumbar spine? What's happening here? The worst position for your low back is sitting forward in a chair. So in 1981, Dr. Natchinson performed an extensive study looking at the intradiscal pressure of the lumbar spinal discs. What is interesting here is that when compared to the pressure or load in the upright standing position, unsupported sitting increases the load going through the lumbar disc by 40%. Similarly, when we look at forward leaning and weightlifting, these positions increase the lumbar intradiscal pressure by more than 100%. Think about that. Once you spend hours in this position, not only will you be adding pressure to the discs, possibly leading to a herniated disc or radiculopathy, but you are also compromising the health of the discs, which can lead to an earlier onset of arthritis, as mentioned before with the cervical spine. So from these examples and seeing how posture affects some of our deepest tissues, we can really begin to appreciate how great of a factor posture is for the onset of tech pain. So poor posture not only affects the body on a deep tissue level, but also impacts the muscles and their ability to optimally support your body. Muscle weakness is much more problematic than people think and is a big contributor to not only the onset, but also the perpetuation of tech pain. I quickly want to take time to highlight what's happening on the muscular level when it comes to resting muscle tone and muscle strength. So, unsurprisingly, a muscle's ability to contract is dependent on the resting muscle length. So, you can see in this picture that if a muscle is resting in a shortened length compared to its normal resting length on the left side of the diagram here, it will not be able to shorten enough to produce a strong muscle contraction, and the force it can produce will be decreased. We call these muscles actively insufficient. Similarly, if a muscle is resting in a stretched out length compared to its normal resting length, there will also be reduced muscle contraction. We call these muscles passively insufficient. I think it's incredible to look at this diagram because we can really begin to appreciate here that once we start to move away from this optimal resting length, we see a really great decline in the force that a muscle can produce. And that's really going to alter the muscle's ability to properly support the joints. So the terms active and passive insufficiency come into play when we look at cross syndromes for the neck and low back. In the neck region, upper cross syndrome occurs when we round our shoulders and our head protrudes forward as we slip into positions of poor posture. The result is going to be a cross between weak and tight muscles. I prefer to think about this cross as an intersection between weak shortened muscles and weak lengthened muscles. Because when you are in this position, the resting length of each of the above muscle groups, both in the front and the back, are going to change. And they are either going to become too short, actively insufficient, or too lengthened, passively insufficient. The result is weakening of these muscle groups over time, which we know puts increased stress on the cervical joints and triggers headaches. So the same phenomenon happens at the low back as well. The abdominals and gluteals will become weak and lengthened, while the lumbar paraspinals and iliopsoas will become weak and shortened. It's imperative to emphasize that over time, both shortened and lengthened muscles lose their ability to contract properly and become weak, undernourished, and eventually painful. The problem is when you start to develop tight muscles, the first instinct is to try and stretch. But is stretching really the best thing to do when you have posture-related pain? The answer is, like all things in physical therapy, it depends. There is a time and place where stretching is appropriate, and your muscles will help clue you in to if stretching is helping or hurting you. One of the telltale signs is how much tension is present in your muscles at rest. One of the ways that muscles compensate for being weak or overstretched is by increasing their resting tension or exuding a feeling of tightness. This is what we call rebounding, and it occurs when a muscle is so weak that the only way it can provide stability at a joint is by tensing up. Unfortunately, there are various ways that one can overstretch and increase the amount of rebounding happening in a muscle. You can be stretching too many times during the day. You can be holding your stretch for too long, or you could even be stretching your muscles past their physiological parameters. All of these things can alter the resting length of the muscle and alter its ability to provide support across a joint. Because muscles are the tissue responsible for supporting the body while moving, when we prescribe stretching, it is not our intention to simply make your muscles longer. That doesn't really serve any purpose at all. Our purpose is to free them from that chronic state of contraction so that they can move the body properly, maintain a healthy muscle tone, and maximize the range of motion at the joint level. So again, why is this important? Why are you continually having pain while working from home? It all comes down to the cycle of tech pain. The best way to avoid entering this cycle is to tackle the root of the problem, which is fixing your unhealthy workspace and turning it into one that best promotes proper posture. Because if you don't, then you'll be working in a poor posture, which will lead to muscle weakness, which will most likely lead to overstretching, which will further the weakness across the overstretched muscle, and the cycle of tech pain will never end. So we need to get you from here to here. And the best way to take you from poor postures to optimal postures is by setting up your workspace at home to better support the body's natural resting state. In the next section of the presentation, we are going to talk about what you can do at home to optimize your posture and minimize your chances of developing tech pain. First, we will talk about setting up a healthy workspace, which helps to minimize the onset of musculoskeletal injuries and has been shown to enhance productivity and promote an improvement in overall quality of life. We will highlight both sitting and standing desk postures, as these are the most commonly used in American households. So when sitting at a desk, the top of your computer should be at eye level, directly in front of you. Your shoulders should be relaxed with arms close by your side. You can protect the lumbar spine by sitting back, keeping your mid-back in contact with the chair with equal weight distributed through both hips. Feet should be flat on the ground with knees bent at a 90-degree angle or greater. When standing, your upper body should be in the same position as when sitting, except your forearms should be supported on the desk to take stress off of the shoulders. You should stand up straight with a slight bend in the knees. Avoid putting strain on the low back and hips by keeping both feet on the ground with weight distributed evenly through them. Now, many of us are working from home without designated office areas or desks. However, even without a designated workspace, there are always ways to be creative and use common things around the home to create a more posture-friendly workspace. If you find that you enjoy switching from a sitting to a standing desk, but don't have a formal one, you can create a healthy space at a kitchen counter or high table. Use stacked books to raise the level of the screen to diminish the onset of neck pain. Some people really love lying on their stomachs, especially kids, while they are coloring, reading, or playing with toys. Protect the shoulder and elbow joints from extra strain by using a pillow or rolled up blanket to support the chest. This will also take pressure off the cervical joints as well, which we know is really important. If you must work from a lounge chair, make sure that you have good lumbar support, as softer chairs will allow you to slip into poor postures more easily. I highly recommend that people who prefer to work from more comfortable places in the home, like in bed, which, by the way, is not recommended, I just like to suggest that people get a lap desk to raise the height of the screen to take some of the load off of the cervical joints and intervertebral discs in this position. For children, use a box as a footrest or pillows to raise them up to the appropriate height when doing virtual school from the kitchen table. If you are shorter in stature and find that the tables or desks you are working at are too high, make the adjustment with pillows to reduce the amount of strain going through the neck, shoulders, and lower back. The general rule is, if you get up from working with pain, you were probably in a position that your body dislikes and you need to change something, otherwise it will persist. It may not always be perfect, but little adjustments can go a long way in reducing the amount of strain on your joints, intervertebral discs, and muscles. Other things you can do to prevent the onset of pain at home is to stay hydrated. Keeping yourself hydrated enhances blood flow throughout the body, which helps to reduce stress-induced pain throughout the workday. The best thing you can do on your own, though, is to keep moving and to move frequently. Taking shorter, more frequent breaks every hour is better than taking longer, less frequent breaks throughout the day. For example, it is much better to take a 1 to 2 minute break every hour versus taking a 30-minute break every 3 hours. If you feel like you have been stuck in the cycle of tech pain, the best thing you can do is consult your local physical therapist. Physical therapists are board-certified healthcare professionals who can help identify what is causing your pain, manually change your mechanical impairments, and give you recommendations for ways to minimize the onset of pain while working at home. While there are general ergonomics recommendations that we can provide, you will see the maximum benefits from consulting with your PT, who will work directly with you to individualize your treatment plan. If you are having pain that persists for more than a few days, do not wait to seek treatment. Again, do not wait to seek treatment. A general rule, something that I tell all of my patients, is that however long it took for you to seek out treatment for pain, it will take twice as long to get rid of it. So be proactive and put your physical health first, because it is much easier to intervene and disrupt that pain cycle earlier on rather than later on. Ultimately, the key to minimizing the onset of tech pain at home is to have a healthy workspace, whether it's professional or makeshift. Keeping the body in positions as close to its natural alignment is the best way to minimize posture-related pain. Remember, pain can present in many different ways, so don't brush off that nagging ache if it comes on consistently while working or even lounging on the couch or in bed. That is your body telling you that something is wrong and a change needs to be made to meet your body's structural support needs. As I just mentioned earlier, taking breaks and staying hydrated is key to minimizing the onset of stiffness and achiness while working. And consulting your local PT is the best way to combat tech pain if you feel that you are already stuck in the tech pain cycle. So that is all I have to present for the day. I want to thank you so much for tuning into this presentation. I hope you have been able to learn something new about why pain presents the way it does in the body, especially when it originates from working or lounging in poor postures. So if you have any questions and you are watching this video, feel free to send an email to info@adirehab.com. And we will try to answer all of our questions to the best of your ability. If you don't already follow us on Instagram, please follow us at ADI Rehab Inc. We will be posting a lot of information there about ways to minimize the onset of tech pain. And we might also do more of a public announcement and a public post answering some of the questions that you may have. So again, thank you for tuning in. We appreciate your time, and let us know if you have any questions. Have a great day. Stay safe and healthy.